All right, so I'm a proud Pittsburgher, proud graduate of Shady Academy, and thank you very much for having me back for this opportunity. I'll start by saying I hope that you all recognize what a privilege it is to get the kind of education you're getting. I was extraordinarily well prepared by Shady Side for college and for future academic endeavors. I also had some experiences with social justice or lack thereof here at Shady Side. I was a lifer here that actually have impacted how I've lived my life personally and professionally. And I have a sense that things have changed dramatically and for the better at Shady Side. And I'm not surprised. And I had the opportunity to talk with Mr. Griffith this morning, and you're in extraordinarily good hands. But the racism, sexism, homophobia that I saw here on the campus was really very distressing, and it has changed the way that I want to deliver health care to people of all different kinds. But I hope that all of you will take all the good parts that you've experienced at Shady Side and use your role as leaders to change the world in a better way. So there was a chant that people used to do when our sports teams were losing at Shady Side in the 80s. It went something like, "That's okay, you will work for us." I hope nobody ever says that. But that was true. The people, the classism associated with that was pretty horrendous, right? I'm sure that's not true anymore. But that sort of entitlement is the flip side of the opportunity that you're having from an educational standpoint. So great gifts demand great action on all of your parts, and I'm sure that you will live up to them. So my background is as a pediatric ICU doctor. I met my wife when I was delivering babies in medical school, and she was resuscitating babies. She's a general pediatrician. And we have had lots of adventures, and you heard some of them in the very nice intro that I was given. But I'd say that our greatest endeavor has been following the dream of having healthcare be more equitable and affordable for all people. And we've lived that over the last 32 years that we've been married. I had the privilege of working at the Cleveland Clinic, great institution, for quite a long period of time. About 20 years at the bedside in a pediatric intensive care unit that I started working in and then led and then went on to leadership positions elsewhere in the institution. And I had an experience there that changed my life relatively early on. And it went something like this. There was a kid with really bad heart disease, structural heart disease that he was born with. And he needed a series of operations, and he got sicker and sicker. And eventually, he ended up on something called ECMO, which is a heart-lung machine that you run in the ICU. And you may have heard that term during the pandemic. We put people on ECMO who were really, really sick with lung disease from COVID. And he needed a heart transplant. And he was in the ICU, his chest was open, he was on the machine, and we were waiting for a heart to become available for him. And I was on call one night. I took in-house call every third or fourth night for about 20 years. I spent a lot of time in the ICU. And I went into his room and I said, "Where's Mom and Dad?" And they said, "Oh, Dad's lost his job because he spent so much time here in the hospital. And they're really not sure how they're going to make ends meet, so they're having a spaghetti and meatballs dinner at the VFW to try and make ends meet. And they're trying to raise a little bit of money." And I said to myself, this is like unbelievably wrong, right? This is just, there's something terribly wrong with how American healthcare is being put together. So we're doing all this high-tech stuff, and they don't have enough money to put food on their table while this kid is waiting for his heart transplant. On top of everything else, while they were having the spaghetti and meatballs dinner, somebody broke into their house and stole everything they had. And So I think Mary Carol and I, and actually all three of our kids, we've sort of focused our lives on trying to understand how health equity can work for people. So let's talk for a second. I'm going to ask you some questions, and then we're going to talk about what healthcare should look like, okay? So I'm going to give you sort of plus minus. I'm going to ask you, so who thinks that we have the worst healthcare in the world in the United States? Okay, not a hand. Who thinks we have the best healthcare in the world in the United States? A couple of hands go up. It turns out everybody's right. So if you need that heart transplant, no place better in the world. So I'm a 2-time cancer survivor. I'm actually here in town in part to speak with you, but in part because I had a bone marrow biopsy day before yesterday at Hillman Cancer because I was in a clinical trial exactly 2 years ago. I was in an ICU with multi-organ system failure for my multiple myeloma. Not sure I was going to survive, and I'm here in complete remission. I came for a bone marrow biopsy. So that kind of stuff, we are the best in the world at. We have the worst public health outcomes of any developed country in the United States. The worst. And it's because we have such an unhealthy population. So, who thinks the United States did well during the pandemic in terms of outcomes? Some hands? Who thinks we did badly? You're right. And the badly part is based on economics. It's conflated with race and some of the structural barriers that people of color face. But here in the United States, the average person lost 1.22 years of life based on the pandemic. Other developed countries, 0.22, so 6 times worse. If you're a black person, about 3.6 years of average loss of life expectancy. If you're a Hispanic person, about 3.88 years. It's totally wrong. And this is not about, some of the structural issues associated with racism play a big role, but it's mostly about economics, because the biggest social determinant of whether you're healthy is how much money you have in the bank and whether you've got good health insurance. And this is what we at Intermountain Healthcare work really hard at. I had the privilege of talking at Allegheny Health Network last night, and there was the question I expected about sort of the other health system across town. And we probably have both AHN and UPMC families in here. Is that probably true? I told them they should stop worrying about each other and start worrying about health in general. Because there's plenty of time, there's plenty of work to go around. Here in American healthcare, we do too much to people and we do too little for people. What I mean by that is our system is designed for people to get paid for doing things to other people. So more operations, more drugs, more interventions, and that every unit of that activity people get paid for. So they do lots of it. What we don't get paid for is to keep people out of hospitals. We don't get paid to keep them well. We don't get paid to make sure they have a roof over their head. Because if you don't have a roof over your head, you're 10 times more likely to end up in an emergency department than if you do have a roof over your head. In my system, we've actually figured out a model where we actually, and we're across 8 states with 60,000 people, 33 hospitals, 500 clinics, almost 4,000 employed doctors. It's a pretty big system. We've figured out how to get paid to keep people well. And the results are really extraordinary. When we changed to this model after I got to Intermountain, Amongst older people, we saw a 60% decrease in hospital admissions. 60% decrease in hospital, 35% decrease in emergency department visits. About a fifth of the cost of taking care of a person went away, and the satisfaction of the doctors and the patients went up. So would you rather be cared for in a sick model or in a well model? I, for one, would rather be treated in a well model. Anybody here really sit down and had a hard think about how the world works after George Floyd was murdered? Did this community have lots of conversations, I hope, about what that meant and what it meant to all of you? Well, we actually did that at Intermountain. My system, before I got there, had a really spectacular reputation, and we were very self-satisfied. And when we looked really hard at ourselves, particularly after George Floyd was murdered, we were able to see that we weren't so great, because the voices of our own caregivers and the voices of our patients and the voices of the community told us that there were lots of inequities. And then we tried to figure out what to do about that. And I happen to work in a part of the country that is very conservative politically. And what we realized is this was not a political problem. This was a human problem. And that by addressing the issues based on humanity, not based on politics, we could be successful. And so we asked our doctors and nurses in each of the clinical areas to start to look at our data and to see whether we had the same problems that showed up in the medical literature. So we looked to see whether black and brown babies were more likely to die after being born than white babies. We looked at whether rural people got the same kind of stroke care as urban people did. We looked to see whether women were more likely to die of suicide if they were in certain demographic groups. We looked at our LGBTQ community and we assessed their access. And now we have 50 different projects going on, and we've turned it into a medical issue, not a social issue. So even people with radically divergent political opinions can collaborate with one another, because nobody wants another person to die or receive bad care based on what their demographics are. Nobody does. Doesn't matter whether you're conservative or liberal, nobody wants that. And it's been wildly successful. And we also now know we're on a journey that will never end, because this work is so deep and so powerful and so pervasive that the opportunity to do extraordinary good over time is all of our opportunity. So then you say to yourself, how do you activate people to do the work? I suspect that every single one of you wants to make an impact, right? Every one of you does. By the way, your generation is so much better than the generation I grew up in. We haven't taken good care of the planet. We haven't taken good care of each other. We've allowed divisiveness and lack of civil discourse to become the norm. I'm actually very confident that you all are the right people to change the world in the way that it should be changed. But the question is, how do you become the kind of leader that can make that difference? And the answers are really simple. Start small. Do something. Do anything. But do it in a direction and see where that takes you. You know, oftentimes, folks in highly competitive schools can have anxiety. Am I going to measure up? Am I going to be good enough? Am I going to get into my first choice college? You know what? Nobody really cares about any of that stuff except for you. You should have fun. You should try hard things. You should fail regularly. I have failed again and again. And Each time I fail, I pick myself up, I dust myself off, and I try again. I'll tell you one of the worst mistakes I ever made was I was really worried when I got into this job that we were selling all this refined sugar in our hospitals at the same time that diabetes and obesity and metabolic syndrome and associated heart disease and kidney disease and stroke was rampant in our communities. And I had the brilliant idea to take all the sugar out of the hospital. Oh my gosh. People went crazy. It turned out that instead of having the desired effect, I created an underground economy and people who would bring Coke in and sell it to their, and not that kind of Coke, like Coca-Cola, sell it to their coworkers. And so eventually I just said, hey, you know, I got you talking, which is what I really wanted to do, and I was wrong, and I walked it back. So look, make your mistakes, pick yourself up, dust yourself off, and do remember that, you know, for those of you who love sports, you know, every single great athlete loses a game, right? And so you win some, you lose some, but we talk about relentless forward progress and unleashing the talents of others. Before we leave the healthcare sphere, let me ask you a couple of quick questions. Who thinks that healthcare is affordable in the United States? Who thinks it's the greatest worry that other people, that your fellow citizens have? Right? The number one concern that people have economically, and besides whether they have a roof over their head, is whether they can afford health care. And that's not right. The only way we're going to change things is by making radical change. We have to change the incentives for how people deliver care. And that means making people uncomfortable. And what I'll leave you with right now is this idea that each and every one of you has an opportunity to make others uncomfortable in a good way, whether it's in healthcare or otherwise. I shared with the pre-med group this morning that probably one of my greatest privileges of my life was to have John Lewis, the congressman and civil rights advocate, an activist, come and visit when I was in Abu Dhabi, and I spent a day and a half with him. And he was a very brave person, didn't completely agree with his politics, but I completely agreed with his passion for other human beings. And what John Lewis talked about is he said that all of us should make good and necessary trouble. Now that's a little dangerous for me to say that here in a school probably, right, Bart? But I'm sure that you want folks to make good and necessary trouble. You need to use your voice. You need to use your actions. You need to act with integrity and courage. And you have to be absolutely intolerant of other people's intolerance. If you do that, and if you use the privileges you've been given with this great education, and if you treat each other well and treat our planet well, I think that under your leadership, the future is very bright. Thank you very much for the opportunity to speak with you today.